Although Guyana has exceeded the first 90 goal of the joint United Nations Programme on HIV and AIDS 1990 targets, there is still a lot more to be done. Minister of Public Health Valda Lawrence, upon revealing in September 2019 that some 8,200 persons are infected with the human immunodeficiency virus, stated that of that total, 93% of them know their status. An estimated 500 new cases of HIV also surfaced. According to the targets outlined by the UNAIDS, by the end of this year, 90% of all people living with HIV should know their status. 90% of all people diagnosed with HIV should receive sustained antiretroviral therapy, and 90% of all people receiving antiretroviral therapy should achieve viral suppression. Even as the current strategic plan approaches expiration, the Ministry of Public Health has already begun discussions for the National HIV Strategic Plan for 2021 to 2025. The first set of discussions were held on Tuesday and engaged representatives from various organizations. Some of the objectives of the new plan involves a multi-sectorial performance overview of the current National HIV Strategic Plan and the conduction of a monitoring and evaluation diagnosis, which is divided into two phases. Director of Disease Control at the Ministry of Public Health, Dr. Nadia Liu, stated that an assessment of the new infections will also be done.
Where did the last new infections come from? Is treatment saving lives and contributing to HIV prevention? And what are the existing bottlenecks that we anticipate the depth of coverage, the speed and the depth of service delivery? What is the value of money for the HIV in the 5-year strategic plan? How effective are the governance and coordinating structures in Guyana? How effective are the M&E structures? And how were prioritized intervention for the HIV program financed during that period?
PAHO WHO country representative William Adukro highlighted the need for the implementation of e-registers, which will be more effective in detecting the disease and preventing mother-to-child transmission.
The new area that we need to make sure that we make inroads is to make sure that we have e-registers and unique identifiers. I think we're trying to have certification for elimination of mother-to-child, and we keep having issues after issues after issues. The last time we had, I think, 18 cases that we're trying to find where the problem is, where the linkage problem is between HIV and between maternal and child health. Ladies and gentlemen, if we had e-register, if we had electronic means, if we had a good record locator, if we had a good unique identifier, this will not be the case.
He stressed the importance of Guyana continuing its pursuit of surpassing all of the UNAIDS targets.
So those who are diagnosed but not on ART, we have to do everything we can to bring them to care. And that will be the second 90. We need to implement return to care. For every one HIV patient who is lost to treatment, we have to make sure that we find that person and bring them to care. Because there's a lot to be gained by that person, bringing that person back to society, and two, making sure that they are virally suppressed, that transmission cannot continue.
Tamika Rodney reporting for HGB Nightly News.